Hi, my name is Susan Fitzsimmons. I'm an infusion nurse here at Pediatric Home Service, and I am here today to show you how to do a needleless valve or cap change on a central line. So the very first thing I would do is wash my hands. You can use alcohol-based hand sanitizer, or you can do hand washing the old-fashioned way with soap and water. Just make sure that you always do hand hygiene before you do any kind of IV anything. So, alright, hands are clean. I have a drape here, and with the paper drapes, one side is paper, one side is plastic. Always put the plastic side down. I like to think of paper drapes as kind of a mental and physical barrier to germs. So I always set one down. Want to grab your supplies, a new cap, 3 ChloroScrub swabs, 1, 2, 3, and then 1 heparin flush. I do always tell people get your ducks in a row before you go to your child, because there are a lot of steps involved in this, and I think that changing the cap really stresses people out. So if you can get as much done before you're actually in front of your child, you'll be a lot more calm and not think of it as such a stressful thing to do. So, as I said, you do need 3 ChloroScrub wipes. If you have 3 and you place all 3 out on your paper drape, you'll always remember all the steps, because you'll always say, oh, I have an extra wipe, I need to do this. So the first step is to open all of your packages. This is considered sterile. The cap, or the needleless valve, they're called both, is considered sterile in the package, but as you guys know, we are PHS and we like to go above and beyond. So I'm gonna scrub the hub on my brand new cap. Do you need to scrub the hub on the one that is on your baby? No, that one is gonna be garbage. So scrub this one, 15 to 30 seconds. And every time you scrub a hub, it's 15 to 30 seconds. The alphabet song, by the way, is usually about 15 seconds, depending on how fast you sing it. Okay, now you want to let it air dry. So if you scrub for 15 to 30 seconds, it takes about 10 to 15 seconds for it to air dry. What I usually do while I'm letting it air dry is I get my syringe cap off. So I do it with the pinky, and I just hold it very firmly with my pinky and then pull off. Now, there are other ways to do that. You can take it, hold your syringe like that, and pull off with this hand. However you do it, just make sure that you're staying sterile. It's been about 15 seconds, so my cap is dry. You want to hold it very firmly, connect it, and twist. So that is connected. Now you want to get that air bubble out. So I always make sure to tell people pull back first and then push up until you see that bubble. And then after you see that bubble, you put the cap to your cap back on, and that's all set. Now you're ready to go over to your child. This is Baby Ivy. Baby Ivy is unfortunately our little doll that we have all kinds of different lines on. So for today's demonstration, we're just going to be using this one because it's the easiest to see. The very first thing you want to do when you come to Baby Ivy is make sure that her line is clamped. So I'm going to clamp the line. Now I open my 2 wipes. I do open them both because I'm going to be using them back to back pretty quickly. So what you want to do is pick up the cap, hold it by the cap, and then you want to clean behind the cap, because that, if you think about it, is kind of where germs are just going to want to, start accumulating. And so you want to make sure that you are cleaning And I tell people the 15 to 30 seconds rule is still applicable, but I always tell people just do it for the full 30 because this only gets cleaned twice a week. These cap changes are done every 3 to 4 days or as needed, such as after a blood draw or if you notice that the cap is visibly soiled, anything like that. So I'm cleaning the back of this. Now in real life, baby Ivy is an infant, so she would be squirming. Sometimes you need an extra set of hands just to maybe, hold the baby or hold your supplies. If you need an extra set of hands, definitely get an extra set of hands. Okay, that is done. Now you want to let it dry for about 15 to 30 seconds. Now, what you want to do is double check, did I clamp that clamp? If you think about why, then you'll always remember to clamp it, because remember, when you take this clamp off, there's nothing between baby Ivy's bloodstream and the world. So make sure your clamp is on. So, cap is off. I do tell everyone when I teach them this that it is go time now. So, barring the roof falling down above my head or baby Ivy having a serious medical issue, my attention will be 100% on what I'm doing right now. Scrub the end of the catheter for 15 to 30 seconds, making sure not to get inside the catheter, just getting around the threads in the end. You want to scrub really vigorously because you are essentially cleaning, germs off of the very most important connection that this IV has. Okay. All right, so I've scrubbed. Now you want to make sure to let it dry completely. And this is kind of a scary time because there's no cap on there. So always make sure that your fingers are holding on to this and nothing is touching it, that you have a firm grasp on the end of the IV catheter. If you don't let it dry, unfortunately what happens is this cap will stick, and it'll stick for a long time, and you might not be able to take it off with the next cap change. So it is really important to let it dry completely. How I take the cap off is I usually hold it, pinch it between two fingers, and then unscrew. I've already primed it so that I have a little bubble at the top. Now you want to connect, making sure it's tight. Don't vice grip tighten it. Now open your clamp, flush your fluid in, take your flush off, that's garbage, and clamp your line. And that's how you do cap change. Thank you.